Hey y'all, can you hear me?
Hi, Libby. Thanks for joining. So we had some tech issues, everyone. We apologize. We were trying to get Libby on for our speaker of the day. So I can see a bunch of people starting to join. We really appreciate you attending this webinar today for our very first Whole Health Louisiana Lunch and Learn series. So Quinn, I'm going to let you take it away here with an introduction to go ahead and get us started. And then we'll migrate over to hear our speaker today, Dr. Sonnier, and we are just so excited. So thank you all.
Thanks, Liz. Hi, everyone. I'm Quinn. I'm a research associate here at the Blanco Center at UL Lafayette, and I'm a coordinator for the Whole Health Louisiana project. I will be moderating this webinar and all of the webinars to come, along with my colleagues at the Blanco Center. So if you're unfamiliar with what Whole Health Louisiana is, Whole Health Louisiana is the state's cross-sector initiative intended to systematically address, mitigate, and prevent childhood adversity within our systems of care and support. It's sponsored by both the Louisiana Department of Health and us here at the Blanco Public Policy Center. So today's webinar is our first Lunch and Learn webinar series. Our virtual Lunch and Learn series features presentations from industry professionals and subject matter experts. We have a webinar planned for one Thursday of each month until December, and each webinar will touch on various topics related to the goals and objectives of Whole Health Louisiana. Our planned webinars are listed on the Eventbrite page that you all use to register for today's event. In addition to the webinar series, Whole Health Louisiana is also conducting in-person regional trauma-informed care training sessions across the state of Louisiana, with our next one being in Alexandria. If you're interested in attending our next regional trainings, feel free to get in contact with me or any of the Blanco Center staff. I'll also have my colleagues drop in the link to sign up for the regional trainings if you're interested in any of our future trainings. So with that, I'm going to go ahead and introduce our speaker, Libby Sonnier, and I'm going to go ahead and read her bio so you guys can get a feel of what she is, what she does, and what kind of things she'll be talking about in today's presentation. So sorry, give me 1 second. Libby is the executive director of the Louisiana Policy Institute for Children since 2019. Recognized for her tenacity and deep commitment to children, she has led teams and system-wide initiatives for the betterment of children, families, caregivers, and practitioners for more than 2 decades. During her time at the Louisiana Policy Institute, she has helped secure and direct more than $1 billion for early child care and education in Louisiana, including the state's largest new early learning investments in a decade and a 20-year millage that creates one of the nation's largest dedicated funds for infant and toddler care in New Orleans. Since then, she has also tripled the Louisiana Policy Institute for Children's Research and Media Engagement outputs and staff, while quadrupling its annual revenues and media engagement outputs, while securing its first 5 7-figure grants. She also helped conceive, launch, and co-chair the steering committee of Geaux, Louisiana, a comprehensive effort that engages parents and early childhood health and education providers in leading the transformation of the state's early childhood systems to better meet the needs of families. Prior to taking on the leadership of the Louisiana Policy Institute for Children, she served as a state director for 2 federal programs where she managed multi-million-dollar budgets. She's developed and implemented pilot programs for children birth to age 5 in 4 states across multiple agencies and community partners to improve the efficiency and efficacy of direct services for children and their families. Her experience in conducting longitudinal and experimental research allow her to translate scientific findings into meaningful and practical policies that support better life outcomes for children. She's the co-author of multiple publications and technical reports, training curricular, and with doctors Sharon and Craig Ramey, the 4 Diamonds checklist and the quality system to achieve results for young children in all settings, also known as the Q-STAR. She's received numerous awards and public recognition for her leadership and advocacy for children, including the Hewlett Serving Spirit Fellowship Award for her commitment to individuals with disabilities across the life course, the Rotary Club Extraordinaire Woman Rising Award, the New Orleans City Business Woman of the Year in 2020 and 2022, and one of the Blue Cross Blue Shield of Louisiana's 2016 women, paving the way for Louisiana's future. She also serves on the boards of Elevate Louisiana, Volunteers of America of Central Louisiana, Southwest Regional Education Laboratories Governing Board, and numerous local and state boards and commissions. She's a graduate of Leadership Louisiana and an assistant clinical professor in Mississippi State University's Human Development and Family Studies Department in the School of Human Sciences, as well as faculty with LSU, Louisiana State University's Early Childhood Education. So she has done many amazing things, and she's received her Doctor of Philosophy in Human Development from Virginia Tech, a Master of Education in Early Childhood Intervention and Family Support Services from the University of North Carolina at Chapel Hill, and a Bachelor of Science in Special Education with an emphasis in Early Childhood Intervention from the University of Southern Mississippi. So again, she has done many amazing things, and she's so excited, as we all are here at the Blanco Center, for her to talk about child care and early education. So I'm going to go ahead and hand it over to our speaker to go ahead and present the topic for today's Lunch and Learn.
Thank you so much. Sorry to make y'all listen to that long bio, but super happy to be with you all today to really talk about early childhood policy in Louisiana and what it means to our families that we all are working tirelessly hard for in our state. Just a little bit about the Louisiana Policy Institute for Children. Our mission really is about advancing policies to ensure that Louisiana's children are not only ready for success in school, but fundamentally ready for success in life. And we envision a Louisiana in which all children birth through age 4 are not only safe and healthy, but they're able to reach their full potential. And we do this by trying to be a source of nonpartisan, independent information and data and really smart policies concerning children ages birth to 4 in our state. And so what we know is that the importance of early care and education is immense. And those first 1,000 days of a child's life become particularly important. And just like the foundation of a house, a child's brain is built from the bottom up, and that these early years of development are increasingly important when we know that 90% of brain development has really taken place by age 4. And the things that happen to a young child in those first few years of life are increasingly important to how they're going to learn, change, and grow throughout their lifetime. And if they have had interactions with, and most of our children have, with adverse childhood experiences, what are the things that we can put in place? What are the systems that we can put in place to mitigate those adverse childhood experiences? And so again, we know that these early years matter. We know that early experiences really affect the development of the brain architecture throughout the child's life and all future learning and health, and that the brain really is like that foundation of a house. And we want to make sure that we're building it right the first time, because we know, those of us in Louisiana, especially South Louisiana, we know that if a foundation is built not well the first time, that it's way more expensive to be able to fix that foundation. And that's the same for a child's brain. And so when we think about that, when we think about the importance of early care and education, we know that there are significant academic and social benefits throughout the life course of a child when they receive quality early care and education during the first 5 years of life. And so I've had the unique privilege of working on one of the longest longitudinal studies related to access to early care and education, not only in the country, but in the world, called the Abecedarian Study. And what we found for those children that received high quality early care and education in the first 5 years of life is that when they receive that intervention, they have higher levels of intelligence, they have better reading and math skills, higher levels of social competency, higher levels of year in school. They're more likely to finish high school, attend college, if they've attended college, earn that 4-year degree, have full-time employment, and better cardiometabolic health. In addition, is what we've seen is for kids that receive that high quality early care and education in the first few years of their life, that they have less rates of grade repetition, less rates of being in special education, tend to be less likely to have teen pregnancies, have risky decision-making behaviors such as smoking and drug use, less rates of teen depression, less reliance on the public health, on the public welfare system, tend to not be overweight, and have lower risk scores. I think the other benefit of this, of having increased access to early care and education, is that it's really a two-gen approach. It's not just all the great things that happen for little people, but it's also what has happened that we have found of the benefits for mothers that have had access to this quality early care and education for their children. And the benefits of those children, of those mothers of those children, mean increased rates of education and better rates of employment. And what we have since found in these kids and their mamas, and these kids are now in their mid-40s, is that these mamas are living longer because they've had higher educational attainment and better job opportunities. And what we've seen in our own state, and just with the LA4 program, compared to students that didn't get pre-K, is that, you know, they have better rates of on-time graduation, qualifying for our TOPS program, more opportunities. They're doing better in academic achievement with algebra, English 2, geometry, biology. And again, to reiterate the longitudinal study findings from Abecedarian, less rates of needing special education services. And so just in our own state, with the LA4 program, we've seen these outcomes. So imagine if we were able to create more and more access for those birth to 4 children, so that you have a cumulative effect of having access to quality early care and education. And so we know that early care and education has profound long-term effects, including all those things that I mentioned, but also children enrolled in high quality early care and education are less likely to be arrested or engage in violent crime. And that quality early care and education can also improve health, social behaviors, and those mothers' employment. So it really is a holistic view of how this one type of intervention can really help a child and their family over the life course. And fundamentally, we also know that access to childcare is good for the economy. And so why do we invest public dollars in ECE, in early care and education? And what we know is that for every dollar that we spend in quality early care and education, we get at least a 13% return on investment. And I don't know about you all, but I don't know where I can put my money and get that return on investment. So why wouldn't we invest that in our children, in our communities, and in our families? And so currently in Louisiana, we know that 67% of children birth to age 4 have all available working parents in the workforce. And so, in that 61% of infants in our state, their mothers return back to work during their first year of life. So that this quality piece becomes increasingly important, because we want to make sure that we've got caregivers and educators that are working with our young children, our youngest learners, that really are attuned to what young children need to provide the quality that really does interface with intervention. And what we know is that childcare in Louisiana costs as much as public college annual tuition. And so statewide, the annual cost for childcare is about $8,700 a year for infants. We know in many locales in our state, it could be as much as $12,000 to $15,000 per child to receive quality early care and education. And so this led us to this piece around Go Far, Louisiana. And you'll notice Go is spelled the Louisiana way with the E-A-U-X. And so we have spent a lot of time talking about, like, we want to make sure that children are prepared to be educated, but what happens if we don't focus on their mamas? And so if we don't have healthy mamas, we don't have healthy babies. And if we don't have healthy babies, we don't have children that are ready to be educated. And so out of the Louisiana Policy Institute for Children, we started the initiative called Go Far Louisiana, which is based on that proverb: if you want to go fast, you go alone. But if we want to go far, we have to go together. And we really want to see how far we can go together to improve outcomes for young children by creating an early childhood system that meets the needs of young families, both parents and their children. And so we believe that we can create a unified, equitable, child and family-centered early childhood system that focuses on racial equity and ensures families have access to seamless, high-quality early childhood development, health, and education services. And to understand about Go Far Louisiana, we have a steering committee that at every point has at least 55% of parents and providers helping to steer the Go Far initiative. Currently, it's a 65% parents, and we have the breakdown is here. What I want you to understand is that we went into community. We listened to community because community always knows what they need best. And so we did this through community listening sessions, and really spent a lot of time listening, going back for feedback in ground truthing sessions and doing online surveys. And we're really fortunate to work with our partners at the Power Coalition for Equity and Justice to do the listening sessions and ground truthing sessions in 2022. And of that came out, we have 5 goal areas within Go Far Louisiana. And I'm going to frame these first by themselves, and then I'm going to tie them together with the Whole Health Louisiana plan, because I think what you'll be able to see is how interconnected the work is, and we all have the same goals. We want Louisiana to thrive, and we want our young children to thrive with their families. So as part of the goal areas within Go Far is a family and provider-driven system, a net that works, a healthy start, childcare for everyone, everywhere, and family-friendly workplaces. And so within a family and provider-driven system, it's really about making sure that families and providers of all types, infant mental health specialists, pediatricians, childcare educators, doulas, you name it, if you're in the early childhood system, especially our families, that you are in places to help make decisions. And so making sure that those formal decision-making structures involve our families and providers, making sure that there's effective government and family provider partnerships so that it's a reciprocal relationship, that parents and providers are talking to our state agencies, to our systems, and there's a constant feedback loop to make sure that things are happening. And that in the early childhood leadership, that we're not forgetting about our youngest learners and their parents. We're not forgetting about that at the end of the day, that we need to make sure that early childhood is seen as an integral system within the systems of the state of Louisiana. One way that we have done that within Go Far is advocate for early care and education to have its own assistant superintendent within the Louisiana Department of Education. And that came to fruition in February of 2024. We also have seen that with laws being made to include families that have children with disabilities to be able to take part in public meetings virtually so that it's more inclusive for them. And we've seen several things. And then additionally, through a grant, we at the Louisiana Policy Institute for Children with Go Far are able to fund an early childhood systems director in the governor's office. The second area is a net that works. We all have networks professionally, but what our families really need is to have a net that works for them. And that net looks like families that are informed and supported, and that they have access to coordinated systems so that maybe one day we will live in a space that we have eligibility systems that talk to each other so that families don't have to do things redundantly that take them away from taking care of their children and also being able to work and be employed citizens within our state. The next areas is a healthy start. And so this really talks about what does a universal healthcare system look like in our state that's accessible and available to families? How do we support parents through those early years, those first, 4 years of life, 5 years of life, where it's increasingly expensive, it's how do we make sure they get the supports that they need? How do we make sure mamas get what they need postpartum and prenatally? And how do we have a system that has improved quality for healthcare and providers? One area, an example of a healthy start that we have been engaged with is with the city of New Orleans, where we have helped support the pilot of the Family Connects program, which is a universally offered home visiting program out of Toro and Baptist Hospital in New Orleans for Orleans Parish families, where they get visited in the hospital by a nurse that then is going to go out to the home within the first 3 weeks of that family being home from the hospital to just see how things are going. And this particular program, Family Connects, has a great deal of efficacy and really listen to families and what their needs are. Super proud of that. But at the same time, United Way of Acadiana has launched a program with auctioneers at Lafayette General and with Our Lady of Lourdes about making sure families are connected to the supports and services and information that they need when they have a new baby. And so lots of good work is happening and lots of good work has been happening. It's just how do we elevate that to make sure that our families know what's happening that related to resources that they could experience. And then the fourth piece is around childcare for everybody, everywhere. It's exactly what it sounds like. How do we ensure that we have more affordable, responsive childcare options for families? We have a lot of shift workers in our state. How do we make sure that they have access to childcare? We know through our state chamber and chambers throughout the state that the thing that their business community is really talking about is having a reliable workforce. And one piece of having a reliable workforce is having access to quality early care and education that is affordable and responsive. And that when we talk about access to quality early care and education, how do we have a competitively compensated early care and education workforce? Because on average in our state, the median hourly wage is $9 and some change for our early childhood educators. They are not babysitters. They are, in fact, brain architects. And if you think about protective factors and really protecting children from adverse childhood experiences, childcare is absolutely one of those places that we can help support as an intervention to address adverse childhood experiences. And then the fifth area within Go Far is a family-friendly workplace. And how do we ensure that there are infant and toddler feeding supports for families, as well as workplace supports. So workplace supports could look like paid family leave, could look like flexible work schedules that you're able to go to your little one's school program. Like, what are we doing as a state that really supports families to be not only good workers and employees, but be able to be good parents, that there's that reciprocal relationship back and forth. And so those are the 5 areas of Go Far, just a quick overview. But how does it fit with Whole Health Louisiana, which is, why one of the reasons why we're here today to look at the policy landscape. And you can see from this chart, if we look at a family and provider driven system and we look at the alignment with the whole health plan, we're looking at collaboration. How do we establish and provide foundational support for a coalition of statewide entities and providers that really drives cross-system collaboration and plan implementation? And how do we raise awareness to that piece if we're thinking about what does a family and provider-driven system look like? If we're thinking about a net that works in whole health, again, collaboration becomes key. But if we're also talking about a net that works, we're really talking about also within Whole Health Louisiana, the places around prevention and healing. How do we make sure that we increase buy-in for investment for, an adoption of trauma-informed care and systems that really meet the needs of prevention and healing of families that are experiencing childhood trauma and communities statewide? And again, that's the same thing with prevention and healing with our Healthy Start. What are the places that we need to make sure that we're doing from the very beginning, from prenatal all the way through postpartum, to really make sure that families are getting their needs met? And how are we preventing future, loss of mamas, or making sure that Mental health needs are being met? And then within Goal 4 of Go Far Louisiana with childcare for everyone, everybody, everywhere, it goes into whole health within the workforce, making sure that we're increasing access and commitment and investment in evidence-based, trauma-informed, and culturally responsive practices. That is childcare in a nutshell when it is done well with quality. And then when we think about goal 5 within family-friendly workplaces, again, this idea of workforce being critically important. And so you can see it here. The areas of overlap within a family and provider-driven system is that both goals really identify the need of engaging policymakers at all levels, and that you'll see the areas of divergence here. But I think the thing that we really want to call to highlight here is that we have so many places that the overlap is here. And I would say Go Far came a little bit before Whole Health Louisiana, but was actually done in collaboration with Go Far Louisiana. And so that's what's so cool, to be able to do the crosswalk walk and show the alignment. And again, here you'll see within a net that works in collaboration is that an emphasis that there is a lack of coordination between systems, between agency and other service providers, and that both plans really see the state agency as a key stakeholders and resources, but put the emphasis of importance of coordinated communication with community organizations. And that really is the desire for Go Far, to have these coordinated systems. And within the goal 3 for a healthy start and prevention and healing of Whole Health Louisiana is that we both are emphasizing the creation of resources and information to share, to support children and families, and that this real critical need of meeting the needs around trauma-informed care is critically important for our state. And then within goal 4 and 5 of Go Far Louisiana, you'll see, which is childcare for everybody, everywhere, and family-friendly workplaces, tied into Whole Health Louisiana's workforce, is that we are recommending prevention of childhood adversity, as well as supporting the workforce well-being, reducing workforce turnover, which is really a key component of anything related to young children, is making sure we have a reliable workforce within the system, so that then children and families' needs are being met, and then the workforce, that for families to be able to be within the workforce as well. And so I say all that to just share some movement that we have seen in the policy landscape within Go Far Louisiana. And I would be remiss if I didn't mention our implementation partners within Go Far Louisiana. They are the policy leads in many of these areas. So a healthy start, I think of Frankie Robertson with the Mandela Group, as well as March of Dimes and many others who helped really support SB 190, which requires the Department of Health to develop a plan to increase Medicaid reimbursement rates to physicians, which is increasingly important so that we have more physicians to meet the needs of our children and families, as well as SB 55, which requires hospitals and birthing centers to provide information regarding postpartum warning signs to new mothers and their families. Again, this is a good thing if we have to make sure people understand. Within childcare for everybody, everywhere, I'd be remiss if I didn't mention our partners with For Providers by Providers, which is an advocacy group of childcare providers, as well as our Ready Louisiana Coalition that really focuses on increased investment in early care and education. And so in the 2024 legislative session, we were able to restore $15 million of $24 million that could have been removed from the state budget. And so we were able to save 1,200 of 2,000 seats and maintain that access to quality early care and education in our state. Additionally, there was in House Bill 786. It is related to the Early Care and Education Fund. An amendment was able to be removed for that fund to continue to focus on birth to 3-year-olds in our state. And then we also watched a bill with House Bill 952 related to CBD cells. And the reason why this is important is because of the Early Childhood Education Fund, a part of that revenue goes into that fund, and that fund offers a dollar for dollar match to locals who are increasing access to childcare. Within the family and provider-driven system, we saw that there's more representation on the Early Care and Education Commission. Additionally, through partners, many partners, one being the Louisiana Partnership for Children and Families, that be able to increase community representation in the childcare in the Children's Cabinet Advisory Board, and making it attendance being more flexible, and then as well as greater authority given to the child ombudsman office to request child welfare records. And then additionally requires special education training for school board members to increase awareness of laws was also something that passed within the legislative session. And then within A Healthy Start, again, many community partners and implementation partners that help support this work. House Bill 148 requires legislation to mandate the coverage of postpartum depression drugs by private insurance. SB 300 closes private insurance coverage gaps for lactation services. And then SB 143 requires healthcare providers who provide prenatal and postpartum care to women to screen for signs and symptoms of hypertension and preeclampsia. All of this together gets to the heart of why we're all working so hard with Go Far Louisiana and Whole Health Louisiana to really mitigate the effects of adverse childhood experiences and how our systems can help make that better. And so you can scan this QR code and become a friend of Go Far Louisiana and keep up with what we're doing. And I'll make sure that I share this presentation back with our friends at the Blanco Center so that you can have this of your own. And then help us spread the word related to Go Far Louisiana. This is an initiative of the Louisiana Policy Institute for Children. It is being led by parents and families and providers, and really has been a catalyst to see some, people come on the same page for the work that's already being done, and how do we collaborate and coordinate together to facilitate not just a surviving Louisiana, but a thriving Louisiana, because fundamentally we know that a stronger Louisiana starts with successful children. I am the co-chair of Go Far Louisiana with my friend and partner, Rochelle Wilcox, who is also the CEO of Wilcox Academy. And then Crystal Critton is our project director with Go Far. And please reach out to us if you have any questions. And I will stop sharing now and happy to take any questions from people.
Thank you, Libby, for presenting. That was so insightful, and I learned so many great legislations that have passed here in Louisiana. And I think that's just so amazing that all the work that we're doing is leading to such a great impact. So now we're gonna go ahead and take questions. If you guys have any questions for Libby, please go ahead and put it in the Q&A. At the bottom, you can click on the little Q&A button and then type in your question, and we'll get to them. So I'll wait a couple of minutes for you guys to think of some very interesting questions for Libby.
While y'all are thinking, I really want to highlight that Go Far isn't doing anything or taking anything away from the body of work that people have already been doing. We really see Go Far Louisiana as a way to amplify the beautiful, wonderful work that people and entities and groups have been doing in the state of Louisiana. There are many of us that have been working on this stuff for a very, very long time. This is just a coordinated effort, listening to community, being in community, to really highlight what our state is saying that they want and they need to have a thriving family.
Well, while we're waiting for questions to come in, I have a question myself. I'm wondering, are there any further legislations that, Go Far has advocated for that's in the process?
Sure. I mean, we continue to think about how do we fund a universal home, universally offered home visiting system. So like you don't have to take it, but making sure that we have home visiting available for families that need it. Fundamentally, we know that no baby comes with a playbook. And even those of us who know a lot about babies, I'm an infant toddler specialist by training and a behaviorist, like this little one's coming into our lives and they're going to throw us a curveball. And how do we make sure that we're supporting families as they bring a new baby home, and able to answer questions and catch things like a mama having really high blood pressure, maybe postpartum depression. How do we catch the signs early so we don't get in a crisis situation? So I would anticipate there being, some more work around the home visiting program, as well as continuing to talk about increased investment in early care and education, because we do know that that helps set children up to be ready for kindergarten and for life. And then again, like how do we make sure that families and providers of all types are in decision-making bodies so that things are being done with them instead of to them.
That's awesome. Thank you, Libby, for your answer. I just wanted to repeat, if you do have a question, please go ahead and put it in the Q&A. While we're waiting for more questions, I do want to repeat what my colleagues have said in the chat about the CEU credits. If you have signed up for nursing or social work CEU credits, you have to make sure that you sign in the credit using the form that they put in the chat, and also fill out the post survey that will come out at the end of this webinar.
And then Anne asked a question, are there challenges you see for families different in different parts of the state? For example, New Orleans has a millage for early care. Can other parts of the state get that done? So in New Orleans, if you felt the ground shift a little bit on April 30th of 2022, New Orleans voters passed a millage to basically to tax themselves to increase more access to quality early care and education for infants and toddlers. And so that millage goes for $21 million a year, up to $21 million a year for 20 years. And so what we've seen is that we know we have a gap of families that are served versus unserved, particularly our families that are at risk. And so New Orleans passing this millage, which quite frankly is the only one of its kind that serves the magnitude of infants and toddlers in the country, really was ground shaking. And part of that has really facilitated conversation around the state, to Anna's point of like, can other parts of the state get that done? And I think many parts of the state are talking about it. What does it look like for us to potentially create millages across the state that would increase access to quality early care and education? What's important about that is that when locals raise dollars, whether it's through a millage or other local dollars or through philanthropy, that right now we have an early childhood education fund that when there's enough money in that fund, it offers a dollar for dollar match. So New Orleans, $21 million a year. If there's enough money in that fund, and right now there is, that grows to $42 million a year. So more children are being served. And what's really cool about the program in New Orleans is they have wraparound services. So they have the mental health supports. They have the supports for the families that are needed and for the child. And so I think that there's an appetite in many places across the state to say, how do we locally step up to support with our own money to make sure that we're increasing access to quality early care and education? Oh, Jordan typed in one. Can you talk more about how ECE workers serve as frontline to trauma-informed care? And so I'll answer the first part of the question is we know that our early educators, they literally are on the front line. They are working with these babies and these families day in and day out. And what we see in our quality centers that are a part of our accountability system is that these teachers have increased credentialing and support to be able to recognize when little ones are struggling. And so if you have a child that's really struggling to regulate their emotions and those types of things, our early educators are able to step in and have this one-on-one experience with children to know that they're healthy, that they're safe, and that they can explore their environment. And so that's important because if an early educator sees something that's not right, they are a mandated reporter. And so we're able to catch children at a very young age to make sure that we're getting the interventions that are in place for families so that a child is not gonna be living in an unsafe place or a place that's risky for them to thrive. The other question related to that was from our perspective at the Policy Institute. What do you think are the opportunities in the state for strengthening the ECE workforce in the area of addressing trauma? I think, if we think about how we really work with our early education educators, again, they are not babysitters. They are educators. They are brain architects. They are helping to build that, 90% of the brain by age 4, is making sure that our early educators actually that their mental health is being supported. If you are an early educator, you're usually in it because you fundamentally love children, but you may be working in an area that you are not be able to make ends meet, that you are an asset limited income constrained yet employed family yourself, and you're like one thing away from not being able to meet your financial commitments. And so I think there's a couple of things. We need to make sure that our early education educators are competitively compensated. They are doing incredible work for our young children and our families. And I would also say that it's really important to continue to have ongoing training and support for our early educators about how do we address trauma. We've seen a greater uptick in children that have really more demanding behavioral needs. And so what we've seen from the State Department of Education and Health is increased investments in really support in infant mental health and the TIKES program through Tulane to really support teachers and dealing with, little people that have big behaviors. And we don't want to get to a point that we're kicking out a 2 or a 3-year-old out of childcare. There've got to be able to be supports in the place for teachers to help manage little people with big behaviors, and that's increasingly important in this state and time. That's all the questions I see that came up. I'm happy to answer any more, but also to just say like a huge thank you for having me and letting us share about the work that we do at the Policy Institute related to early care and education, really being a preventive piece for many families and young children, and also letting us walk through what it looks like from the Go Far initiative and Whole Health Louisiana to really see where we're united and moving towards the same goal. I have another question. How can we address areas of the state with childcare deserts, especially rural areas that may have few options for parents? One of the things that we are about to undertake is to do a study on family childcare in our state, because many places that don't have like a formal early care and education center, what's happening for families that need childcare is they're using family childcare providers. And so understanding what are the needs of family childcare providers in our state and what kind of supports that they need, especially if we think about trauma and adverse childhood experiences, and making sure that we create a network within family childcare providers so they can rely on each other and help meet the needs of their families. Another question is, are there any grants to help increase the pay for ECE workers? We have done a body of work at the Louisiana Policy Institute for Children to really think about what does a compensation ladder look like in our state. And so we had a Tiger team, Dr. Candace Weber on our team led that to really first look at that. What does a compensation ladder look like? The other thing that we just received a grant through philanthropy to really study how do we in fact increase pay for our workforce within early care and education. And so that grant is called the Early Childhood Collaborative Investment Grant. We're doing work in that right now with pilots around the state in places like Point Coupee, Jefferson, Orleans, Baton Rouge, and some other places to really figure out how do we look at our systems and figure out how do we increase the pay for early care and education educators in our state. Another question was, I wonder if you can speak supporting all working adults in every business system. This Cynthia says she totally agrees about the support needed for early childhood staff, but we also see trauma and how it affects adults in every system. I think we're all traumatized to some degree. This is not really my area of expertise. We really are squarely focused on children birth to 4 in that workforce. But I think the same things that would be true for early care and education, making sure that we're meeting the needs of their mental health needs would be the same for within any working adult. So how do we support them? I mean, I know in my own organization, what are the things that we need to do to make sure that we are supporting our own people within our team, and that can mean time off, taking a step back, those types of things. But that's not really my area of expertise.
Thank you, Libby, for answering all of these questions. Does anyone have any further questions that they'd like to ask, or any even comments, or anything? Okay, so we have still have a couple minutes for today's webinar, but if there aren't any questions, we can end it early. But I do want to give a huge thank you to Libby for speaking today. It's a great presentation, and I hope you guys learned as much as I did today. I would also like to thank our interpreter, Lisa Gill, for being here and providing support as well. And thank you to you all, the attendees, for coming and taking your some time out of your lunch to come and attend this talk. So I'll just say last call for questions or comments. And I also want to point that the webinar recording will be posted in 1 week on our Blanco Center YouTube account. It's in the chat. If you're interested in following us on our YouTube accounts, all future Lunch and Learn webinars will be posted there for you to review. And again, for the CEU credits, if you're completing this webinar for a nursing or social work credit, please be sure to fill out the sign-in sheet as well as the survey at the end of today's talk. If you're interested in attending regional trainings, all of that information is in the chat as well. And if you want to sign up for our next Lunch and Learn, which will be next month on the 17th, we'll be having Dr. Allison Triggs Booth, who will be speaking to us about childhood mental health.
Just one last question. Are there any educational requirements for ECE, and I'm going to say educators here, and grants that improve education? So there are. So to be in the accountability system, which we call these early care and education centers, type 3 centers, to be a lead teacher, you have to have an ancillary certificate, which means that you've gone through coursework to support child development and have had coaching along the way. And the way that many of our early care and education educators get that credentialing is through the Louisiana Pathways program that has that have grants to be able to support teachers to do that.
Okay, awesome. I think that is the last question.
Yes.
For today. Yes, I see. Okay. So again, thank you everyone for attending. Thank you, Libby. Thank you, Lisa, for your support and for presenting. Again, our next Lunch and Learn will be next month on October 17th. And we hope to see you all there and at our regional trainings as well. The next one is in Alexandria. So thank you all, and hope you guys have a great rest of your day.